Veterinary Clinic of Ottawa.
Hi.
How are you today?
I'm okay, but Bambi here seems to be feeling a little bit under the weather.
Oh no, what's the problem?
Well, he's been gagging a bit and seems a bit more quieter than normal.
Alright, Mrs. Horn, I'm writing this down for you, and I'm going to take Bambi to the back to see the doctor right away. So I'll be right back.
Okay, please be careful.
I will, thank you. So the doctor observed that she was having some trouble walking and her hind legs seemed to be having trouble holding herself up. They're currently running some diagnostic tests back there. We have her set up on oxygen.
Okay.
And any extra IV fluids just to keep her hydrated to help her body
Great.
recuperate a little bit. While we are waiting, do you mind if I grab some information from you?
Yeah. What do you need?
So may I have your full name and your telephone number, please?
Okay, Mrs. Laura Horan, 613-123-1234.
Excellent. Thank you. Now I need to know a few things about Bambi. We know she's a female Great Dane. Approximately what age did you say she was?
About 4.
About 4. Great. Now, how about any prior conditions you're aware of? Was she sick, or did she have any parasites maybe?
She seemed perfectly fine until about a day ago when she started doing all those gagging and being quiet. Yeah.
Okay. So Bambi is in the greatest hands right now, I can assure you, and the veterinarian is doing everything they can to help Bambi right now.
Okay, great. So you were talking about the diagnostic test before. What does that mean? I don't really understand.
So that means that, that they're performing tests to rule any certain medical condition. So they're performing blood tests, they're going to analyze her urine, and they're going to do a full physical examination of her body, and maybe even some x-rays depending on what they may or may not find.
Okay, that makes more sense. Thank you for telling me. That's very nice of you. It makes me feel better because I'm really nervous about my baby.
Oh, and don't worry about it. She's great. I'll be right back, okay?
Okay.
Hi, Mrs. Moran. My name is Dr. Stiles.
Hi.
I have an update on your little Bambi.
Okay, great. Is there any good news?
Well, I have diagnosed her with gastric dilatation volvulus, or GDV as we call it. This means that her stomach has been twisted around on itself and is now full of air.
Wow.
I first came up with this as I noticed that her belly was a little bit more protruding than normal and more round. The gagging noises you were hearing was basically, they were like retching, so kind of like trying, which is a huge indicator of GDV. So right away, I got her on the table for some x-rays, and that's when I noticed her air was fully filled with,
Oh my gosh. Is it my fault? How did this happen?
Oh, no, it's no one's fault. Larger breeds are actually more prone to this. It could be because they have deeper chests than like a smaller dog would. Excuse me. Does your dog like to gobble up her food or excessively drink her water?
She basically just gobbles it up in like 5 seconds flat.
Oh, I see.
Yeah.
Yes. Well, that is also a strong indicator that GDV could potentially be a disease or a syndrome, I suppose. But don't worry, Mrs. Horn. We have everything. We've caught it early enough. We have everything perfectly under control, and we rushed her directly into the operating room where a specialist will operate right away on Bambi, and everything will be fine.
Okay, that's great. What's going to happen in this surgery?
Well, so the doctor's essentially going to go into her abdominal cavity, put the stomach back to the way it was, and then into the original position. Sorry. She seemed in good spirits when we were handling her, Mrs. Horn.
Okay.
Why don't you wait here while I go check on Bambi? How's that sound?
Okay, great. Hi, Kelsey. The vet just went back. Did he send you back out to tell me some information?
Yes, he did actually. He wanted me to tell you that he's just looking after a patient right now, but he's back any minute. So Bambi's out of surgery and she was doing awesome. We've given her a good amount of pain meds so that she can't feel any pain right now, which is really good. We've kept her on IV fluids to keep her hydrated because surgery takes a lot out of a patient. She does have a large bandage on one side of her body due to the abdominal incision. She's currently in the intensive care unit of our hospital, though.
Okay, am I able to see her or?
Yes, absolutely. You're able to come look through the window just because we don't want to get her too excited.
Wow, she looks great. I'm so glad she's looking in good health.
Yes, we are actually very pleased with how well she recovered. We still need to keep her at our hospital for approximately about 3 to 5 days just to make sure we can monitor her closely enough in case anything were to happen.
Right, that makes sense.
Okay, great. Well, we will consider to administer the medication that she needs so she doesn't feel the pain from surgery, as I mentioned before. We will also replace the bandage to make sure she goes home with a fresh bandage for you.
Great. This is the best vet clinic ever. Thank you so much for taking care of her.
Not a problem, Mrs. Horan.